Well, up first on the show, let's take a look at how the COVID curves are flattening in Israel and beginning to perhaps flatten in the United Kingdom. Now, Israel's vaccination program is showing signs of working to drive down infections and illness in over 60s. The fall appears to be the most pronounced in the older people and areas furthest ahead in their immunization efforts. This suggests it is the vaccine and not just the country's current lockdown that is having an effect in driving down the COVID numbers. The Ministry of Health data in Israel suggests infections and illnesses fell consistently from 14 days after receiving the first jab onwards. That's the biggest fall observed was in people 7 days after they received the second dose of the vaccine. This cannot be used as evidence or for or against the wisdom of UK strategy, however, of delaying the second doses. So if we take a look now at the UK, Prime Minister Boris Johnson has said there are signs that the lockdown is working, but warned it is too early to take your foot off the throat of the beast by easing restrictions. The country is under a third national lockdown and will remain in place until at least mid-February or even March. Now, the lockdown was imposed in response to the fast-spreading variant of coronavirus that has overwhelmed Britain's hospitals. As of late January, more than 5 million people in Britain have now received their first dose of the vaccine, mostly healthcare workers and the elderly. Nobody's received that second dose, at least that's the plan so far. So the gap has been increased between the first and second dose. Now, something that has emerged in a study in the UK, there may be another addition to the growing list of strange possible symptoms of the coronavirus. Although fever, fatigue and dry cough are some of the most predominant signs of COVID, a rare and strange symptom has been established amongst COVID patients in recent past, which causes infection inside the mouth called COVID tongue. A British researcher who is helping to track COVID warning signs is reporting more cases of infected people complaining of tongue discoloration, enlargement and other mouth problems. Researchers say they're seeing increasing numbers of COVID tongues and strange mouth ulcers as well. Well, to talk more about this new symptom, Dr. Rajay Narayan, Director of Global Health Alliance UK, joins us. Dr. Narayan, first and foremost, tell us, what do we know about this COVID tongue? Strange patches appear on the tongue. It sounds quite alarming.
Yeah, so there was a study which was, as you rightly said, by King's College, by Professor Tim Spector, who did a study on about 500 patients with COVID. And he found that almost about 1 to 2 patients out of every 500 have got some strange symptoms in their mouth, which may include swelling in their mouth, swelling in the tongue, some strange patches on the tongue, some small ulcers on the tongue. But as far as clinically, we have seen more than thousands of cases of COVID across the UK. And we have seen few of these patients, especially who are admitted for longer period of time on the wards or on the ICU. As you know, that people who are immunocompromised, people who get some viral infection, they're likely to get small ulcers and patches in their mouth. But it is also very important that we should not get too alarmed about it, because these are all very early signs, early research. Not every patch in the mouth is COVID, just like not every fever, not every dry cough is COVID. Not every patch and not every ulcer in the mouth is COVID. But yes, this is COVID times, and if you do get small ulcers or small patches on your mouth, that it is important that you get screened for COVID.
And is there any indication whether this is linked to the new variant of coronavirus, the more infectious one?
No, there's no signs and symptoms as far as the new infection is concerned, the South African or the Brazilian variant that you're talking about. It's not been linked to any of those variants. But yes, we are seeing some more number of cases which we had not seen the first 6 months of the pandemic.
All right. And if we talk about the situation currently in the United Kingdom, the Prime Minister talking about how now the COVID curve seems to be flattening. So good news coming in there, though he says it's because of the lockdown and the lockdown is working. And how's the vaccination program proceeding?
Yeah, I would say that it's just too early to say anything, because again, there is a small drop in the number of cases, although we are still seeing almost about 1,000 deaths every day in the UK. We have got about 30 to 40,000 positive cases on a daily basis. So yes, the lockdown is definitely working. The vaccination is going very smoothly, and a lot of people have been vaccinated. Almost 95% of people above 80 have been vaccinated, which is a big achievement as far as the vaccination program in the UK is concerned. Most of the healthcare workers have got their first dose of the vaccine. As you know, that the strategy in the UK is slightly different compared to the rest of the world, and we are trying to delay the second dose. Well, hopefully, the strategy should work, because we are trying to give the first dose of the injection to as many people as possible.
And is there any sort of, thought on that, any discussion on that, given what we're seeing in Israel? We just talked about Israel and how after the second dose is when they're seeing that the numbers are significantly coming down in the over 60. So it's showing that the vaccination is working in controlling the infection.
Yes, absolutely. I mean, as I said, that it is very important to try and get the immunity to maximum number of the citizens in any part of the world, whether it be UK or Israel. I know there's a strategy of getting the first dose and delaying the second dose is different in the UK. This is not part of the initial research that was done by AstraZeneca and the Pfizer group. But yes, this is something that England has done in the past in some of the vaccination program, and it has worked, and we are hopeful that this strategy will work for the COVID as well.
All right. Well, thank you so much, Dr. Narayan, for joining us there with the latest from the UK.
Thank you.
Well, let's focus on India numbers now, and with 8,635 fresh coronavirus cases in the last 24 hours, India has recorded the lowest single-day rise in its tally in nearly 8 months. We've had a total of 1,766,245 infections since January 30th last year. More than 1.04 crore patients have recovered from the disease, and 1,54,486 deaths have been recorded in the last 24 hours. 94 deaths of patients who contracted COVID were reported from across the country. So if we take a look at the states that have been worst affected or reported the most cases, you have Kerala at the top of that list with 3,459 cases, Maharashtra following with 1,948, then followed by Tamil Nadu, Chhattisgarh and Gujarat. Now, given those numbers, the centre has rushed high-level teams to Kerala and Maharashtra for supporting the states in their public health interventions for COVID management. At present, these two states alone are contributing to almost 70% active COVID cases across the country. Well, to talk more about the cases in India and the way we're seeing the COVID trajectory going, we're joined by Dr. Romel Tikku, Associate Director, Internal Medicine, Max Healthcare. Thank you so much, Doctor, for joining us. And as someone, who's been with us since the start of this pandemic and since the crisis and the peaks that we've seen, it's quite heartening now to see how the COVID numbers have come down.
Well, I think India is doing exceptionally well. You see, in the last 24 hours, there have been less than 10,000 cases and less than 100 deaths. And if you look at the previous 2 weeks, we've had less than 15,000 cases a day and less than 200 deaths a day, which is like exceptional. So if you compare it with Europe, UK, US, I mean, they're having a tough time because of the mutant strains. And even with the UK, 25,000 cases now. Earlier, they had 50,000 cases. And US has come down from 3 lakh. A lot of cases are limited to Maharashtra and Kerala. And Kerala is still having 4,000, 5,000, 6,000 cases a day, which needs to be looked into. That's where the center wants to focus on these two states. So I think in Kerala, probably the elderly population or the number of diabetics or people with comorbidities must be playing a role. But we'll have to focus on these two cities. Other than that, Delhi, UP, Rajasthan, Bengal, Punjab are all having less than 200 cases a day, which is like great. And with the vaccination happening in healthcare workers and millions already being vaccinated, and the coming few weeks and months, we'll have more and more people who are getting vaccinated. Once we reach that 3 crore priority population, I mean, we are through. So India is doing much better if you compare it with any other country right now.
And in fact, this is, a lot of people are questioning how is it that the numbers are coming down. And when we talk about Kerala and Maharashtra, Kerala has talked about how they've been, while their numbers of cases may be high, they've been really good at maintaining a low death rate, and that they really chase each and every case. They do a lot of contact tracing. Is this one of the reasons that we're seeing, high number of cases being detected there? Are there other states like UP and Bengal, do you think maybe, not testing as much, or maybe not contact tracing as much as required?
No, I don't think so. I think initially they did very well. Kerala did very well and the lockdown was in place. But later on, with the economy opening up and movement happening, I think at some point it has to hit us, all the states. And somebody has to, all of the states will have bear the brunt of COVID. And that's what happened with Kerala. And later on, the numbers spiked. And even with Onam and the celebrations, we did see a sort of a peak happening there. And gradually, I think things will settle down. Now we're having some 4,000, 5,000 cases a day. Maybe with time, there will be 2,000, 3,000. And in the next month, they're lagging behind the rest of India by, I think, 2 to 3 months. So I don't think there's any other particular reason. They've done well, exceptionally well in the beginning. But now The numbers are catching up, and this does happen. Look what happened in Delhi in the month of November. There was a huge spike. And now if you see at the zero conversion rates, almost half the people in Delhi would test positive for antibodies. So at some point, it has to happen in all the states. And I think gradually each and every state will have some sort of herd immunity. And Maharashtra also, for that matter, is reaching there slowly and progressively. If you look at Bombay, 400-500 cases a day. I mean, 5-6 months back, look at what was happening in Delhi and Bombay. So I think gradually everyone will reach herd immunity. All states will have to go through it. Maybe Kerala is lagging behind, but gradually I think next 2-3 months, they will also reach there finally.
All right. Well, time now for our viewer question segment, Doctor. So let's just listen into the first question.
This is Akshay Syal from Delhi. As we have seen, government has allowed a lot of schools and colleges to open. Is it actually safe to open school and colleges now? Thank you.
Doctor?
Well, it's a tough question to answer, but there's no hard and fast rule. It depends actually on the situation at that point of time when the schools are opening. If the government has decided to open schools now in the higher classes, it's because the situation is much better in India right now. So once the numbers go down, it just gives you that sort of a security And it also depends on the school, how prepared they are in handling it, whether the SOPs, the protocols are in place, whether they'll be able to do justice to it. And because it's not a normal functioning of the school, the lunch breaks have to be staggered, the sports activities have to be curtailed, and there has to be cleaning of the equipment, maintaining distance between the desks and stuff like that. So I think, yeah, gradually at some point it has to happen. And even in European countries where they did open schools in the past, they did not see any huge spike in numbers. But having said that, in children, they don't get too severe disease, but they can always bring it back home.
All right. And so therefore, there has to be a level of alertness after schools and colleges are opening. Now, let's just listen to the next question.
Hello, doctor. My name is Neha, and my question is, when will the vaccine reach the common man?
Well, right now, it's the healthcare workers who are getting vaccinated, and then it will be the frontline workers, and finally the priority population. Initially, it's the 3 crore priority population which gets it, and then the 50 and above age group, they are the vulnerable population, and then 50 and below with comorbidities. So I think in the next 2-3 months, once we cover these 3 crore population, finally it will reach everyone. And maybe at some point, if it becomes available commercially, and we'll have more and more vaccines in place. So in the coming 2-3 months, I think we'll have clarity on this, but 2-3 months maybe from now.
All right. Well, thank you so much, Dr. Tikku, for answering those questions and joining us on the show.